Years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Living a Longer and Healthier Life show for Tuesday, June 30th, 2020, last day of June, halfway through the year here. And we're going to be talking this evening about the ears, nose, and throat with an ENT or otolaryngologist. I may have said that a little funny, but I think I got it pretty much correct there. So we have Dr. Hina Gupta. She is with South Florida ENT and Associates. Their locations are now open to serve their patients and communities. Patients can request an appointment online, and we're going to give all the info there as well. Dr. Gupta received her doctorate at UMKC with an AOA distinction. She completed her residency at the University of Iowa, world renowned in the field. And Dr. Hina Gupta is trained in the latest surgical techniques and treatment, and above all, holds the patient's interest at heart. So without further ado, I'm going to welcome Dr. Hina Gupta to the program. Dr. Gupta, how are you doing this evening?
I'm doing great. Thank you for having me.
Thank you, and I hear you loud and clear. So, we got a lot to talk about. Since last time, we had you on in 2018, a lot's changed, and I think we focused a lot on earwax and the ear during that broadcast because I found it interesting, at the time that, why we shouldn't maybe use, Q-tips all the time, that how it pushes the earwax in. But tonight I want to talk to you a little bit more. Obviously, your practice has grown in the last few years. You got a beautiful practice there in Coconut Creek. So let's start with that. We'll save the earwax talk to the end. So how has your ENT practice changed during the COVID-19 pandemic, and what can you tell us about the safety protocols in place at your office? Because I always tell people on the show, doctors have been using gloves and masks for long before all of us were, trying to stay safe during this pandemic with those uses. But what are you doing at the practice to stay safe?
Well, during the lockdown, we were only seeing semi-urgent and urgent patients. But then since it seems like this is going to go on for a long time, we're now seeing all of our patients but have a screening protocol and temperature check in place when the patient arrives, similar to basically all the hospitals across the nation. And all of our front.
And that's great as well. We have Dr. Gupta's photo on the screen and her info on the screen as well. It's Dr. Hina Gupta. Yeah, so offices, obviously, we're already, safe, but lately, they've made different changes in protocols, and, they're adhering to the guidelines. And Dr. Gupta, you're the second doctor in the last week and a half who said, we know this pandemic's going to go on for a bit, so we should probably expect this. Obviously, with the growth here in Florida, expect to look for safety protocols in the offices, the clinics that we're visiting, as well as, adhere to guidelines. So that's great that you're ahead of it. Tell us a little bit about your office. I haven't been to it, but I've seen pictures online, and it's one of the most modern, beautiful, brand new offices that I've seen. I've heard about. I know people who've been there. So can you tell us a little bit about your office and staff? Looks like we may have lost Dr. Gupta there with the connection, so I'm going to have her call right back in. But since I've already been talking about the office, if you want to check it out for yourself, there's some great pictures of the office. The website is sfenta.org, so like South Florida ENT, and then the letter A.org. The number's 954-943-1418. They are open 8:30 a.m. to 5 p.m. Monday through Friday at 4515 Wiles Road, suite number 201 in Coconut Creek. I think I hear Dr. Gupta, we got you back on?
I think so. I don't think I was gone, but maybe it was dropped.
Oh yeah, for a second I lost you there. Yeah, we're on. We're good to go. So I was just telling everyone how modern your office is. I haven't been there in person, but it's beautiful pictures, and I know people have been there. Tell us a little bit about your modern ENT office there in Coconut Creek.
So we opened our facility about 2 years ago, and at that time we had ENT, GI, and urology services, and then since then we now have pain management, orthopedic, spine, and interventional radiology. And then downstairs, we have a full-service radiology center.
That's fantastic, and it's convenient, large parking lot, and it's very modern space, right? This is a new building.
Yeah, it's a completely new building. So, yeah, we're very happy, and we wanted to keep it convenient for our patients so that they can come in to get their hearing screening, that they can come in and get pretty much all of their care.
Yeah, let's talk a little bit about that care. As an ENT, what is the most frequent question you're asked when people come in?
So, David, that's a difficult question because oftentimes a patient comes in and they say, Doc, I came in for my ear, but sometimes my throat hurts, and sometimes I'm dizzy, and sometimes my nose is congested. So usually it's not just one complaint that people come in with. They usually come in with multiple issues. And the first thing is a good examination of the patient so that we can target what's really a problem. Oftentimes in stressful times, especially now with the COVID pandemic, people experience stress, and it manifests in the head and neck as pain syndrome. And so we see a lot of people who are like, Doc, I've been on antibiotics 3 times for an ear infection, and it turns out to be something else altogether.
That's interesting. So, yeah, since COVID, things have changed in a lot of different fields. I'm hearing that from a lot of doctors in neurology and cardiology as well. But, yeah, I find that fascinating that, this virus, obviously, it's got a lot of different ways that, mutates, etc., and causes ailments in the body. But, yeah, I find that interesting. That's also happening, with the ailments you treat. So there are a lot of different ailments, like Dr. Hina Gupta just said. If you can go to the website, sfenta.org, they're all listed there. So there are a ton of ailments, obviously, with the ear, nose, and throat. Now,
right.
Tell us a little bit in the office, in terms of treatments. What can you offer in office? I know it's probably a lot as well, but tell us a little bit about treatments, and then I'll ask you about diagnostic services as well.
Right. So when patients come in with hearing loss and dizziness, we offer complete audiology services, both for children and adults. We have an audiologist who comes to our office every Wednesday morning. In terms of treatments and problems regarding the nose, we have balloon sinuplasty, balloon septoplasty. There's a long list of services we do, including making your turbinate smaller, freezing your nerve so that your nose isn't runny. There's a lot of new cutting edge things just in the last 2 years since I've last been on that's now available to improve your quality of life.
Yeah, I was just looking at the website. Yeah, allergies as well is something that ENT can help out with. Asthma, deviated septum, dizziness. That is big. And you know what? When you said that early on, I thought of a neurologist, but ENTs can help with dizziness. Can you elaborate a little bit more on that?
Yeah, so dizziness can be from many different things, like heart problems, arrhythmias, low blood sugar, low blood pressure. But when dizziness is in particular presents as a spinning sensation, it can be from an abnormality in the inner ear. And that's when an ENT doctor, an ear, nose, and throat, or otolaryngologist can help with both diagnosing and treating inner ear dizziness, which would present as room spinning, also called vertigo.
Exactly. Yeah, that makes sense. Now it's all coming together to me. I'm a little more the general guy here. So thanks for explaining that. Again, we're on with Dr. Hina Gupta, otolaryngologist in Coconut Creek in Broward County. The website is www.sfenta.org. That's the ENT medical specialist. Her number is 9549. Oh, go ahead, Dr. Gupta.
Oh, I was going to give you my second website, too, which is entbroward.com. entbroward.com. And it specifically highlights basically all the services that we offer, including allergy skin testing, audiology or offering hearing tests, as well as evaluating all of these nasal complaints that we talk about. So there's a lot of things that we cover as an ENT doctor.
Okay, entbroward.com. Thank you for clarifying that. That'll help, and we'll give that out a few more times. Yeah, I was just also looking. We obviously talked a lot about the ear last time because I started the program talking about the earwax, but you ENTs can also help. I'm seeing here on the website with head and neck cancer. Can you explain a little bit about that as well?
Well, head and neck cancer can present as many different things, like a lump that you feel in your cheek or in your neck, or skin cancers that cause lymph node enlargement, or they can present as thyroid nodules that are thyroid cancer. So all of that is included above the clavicle.
That's great. Wow. A whole different, I should say, a whole line of different ailments that Dr. Hina Gupta treats. You just said parathyroid disease, head and neck cancer. Obviously, with the throat, salivary gland disorder, different throat, ailments as well. Snoring and sleep apnea, I found that interesting as well. ENTs they really cover a lot of different ailments and provide a lot of different treatments. It is a very vast field, isn't it, Dr. Gupta?
Yeah, and one of the things that we do very commonly in clinics is called nasal endoscopy or laryngoscopy. And so instead of just looking with a little speculum, we can look with a camera and identify structural abnormalities or infections or anything that kind of presents deeper with the look with the camera.
That's fantastic as well. Is that, I know you have your clinic, your office, and then you're on staff at I believe 3 different hospitals, which we can mention in a minute. But now the looking at the throat with the camera, is that something that's done in the office or the hospital setting?
No, it's done in the office. We basically do a numbing protocol. And so we can take it's like a little spaghetti. That's how we describe it to patients, where you have a little tiny camera, a 4 millimeter small lens that can go through your nose and observe your larynx all the way down to your voice box.
That is just amazing that can be done in office with a numbing agent. That is just amazing as well. And then you mentioned before the balloon. Is it the sinuplasty?
The balloon sinuplasty. Yeah, that's part of the nasal. Can you hear me, David? Am I echoing, by the way?
Yeah. No, you're great. You sound great. Well, I can hear you loud and clear.
Oh, great. So when somebody comes in with trouble breathing or headaches, then they can have a number of things. They can have an allergies where their nose is swollen, or it can extend to cause chronic or acute sinusitis, where you're on antibiotics all the time. So oftentimes we check with what's called the nasal endoscopy, which I just mentioned, and then we follow up with a CT scan of the sinus. And if you're a candidate, there's things that we can do in office with minimally invasive procedures, where you come into the office and we can open up the natural pathways of your sinuses and help you breathe better. And then you just go home the same day.
Yeah, because there's nothing like, breathing properly. That's quality of life right there. If you're not breathing properly, you're going to have a tough time, getting through the day and the night, of course. So let me give out Dr. Hina Gupta's info again. The website is entbroward.com. The number is 954-943-1418. She's located at 4515 Wiles Road, suite number 201, Coconut Creek. Beautiful office building, state of the art, brand new. Go on the online and look at the pictures. It's amazing. Again, entbroward.com is where you can get a list of the ailments and conditions Dr. Gupta treats, and open Monday through Friday, 8:30 a.m. to 5 p.m. as well. Dr. Gupta, do patients need a referral to see you as an ENT, or can they call your office directly or book an appointment online?
So it depends on their insurance requirements in regards to if a referral is needed, but we're always happy to navigate this with the patient. We take both online appointments, and we're always happy to take phone calls because these questions do often arise. Do I need a referral? Do I not? If you're going to need a procedure, do I need an authorization? So these kind of things we are happy to answer anytime.
That's great. Yeah, because, everyone's got a different insurance and different, setup. And if Dr. Gupta's got a great staff, so you can call and get your questions answered and then get in there for an appointment and get back to better quality of life. Because, visiting the doctor is the best thing to do. Even in these times, we start out the program talking about Dr. Gupta's safety protocol at the office. I'm a testament myself, preventive care, going to see a doctor right when, you have an issue, gives the doctor so many more tools to work with in fixing the problem or ailment. And, earlier is better, especially when we're talking about things like head and neck cancer and thyroid as well. Dr. Gupta, why is it important? So you're a board certified otolaryngologist, and I hope I'm saying that right, but why is it important to see a board certified otolaryngologist?
So after high school, there's 4 years of undergraduate degree, and then there's 4 years of medical school. And after medical school, every physician undergoes a training. And for surgeons in otolaryngology and head and neck surgeons, that's at least 5 years. And so after that training, we take an exam to become board certified, and that includes both a written test and then an oral examination in front of the different physicians. And so after that, once you pass that test, you become board certified. But it doesn't stop there. So after that, the American Board of Otolaryngology monitors you every 10 years with ongoing tests, just so that we can know to keep up with the changing evidence-based medicine. Even in 2 years since I came on your show last, there's new things and new procedures that we can offer that we weren't doing 2 to 5 years prior.
That's fantastic explanation. In 5 years doing this show and asking about board certified and the reason why we should see a board certified doctor, that is the best explanation I've ever heard. That was right on. That was fantastic. So thank you for sharing that, Dr. Gupta. No, really, I really
Yeah,
mean that. I've heard that a few times, and that was really right on.
good.
What other
So
professional
after,
memberships? Oh, go ahead.
yeah, go ahead. No, go ahead. I was just about to answer that.
Oh, yeah.
And
What other
so,
professional memberships do you hold?
so not just being part of the American Board of Otolaryngology, but I'm part of the American Academy of Otolaryngologic Allergy, since we practice allergy in our office. And so these board certifications and kind of being part of the board helps you keep up to date with the new treatments and new procedures that we offer.
That's great as well. Yeah, because definitely, you know, you definitely want to see a doctor or a physician who has, the latest treatments available, the latest care available, especially with what's going on, how healthcare is changing and how health, monitoring is changing. And, Dr. Gupta even talked about some of the different symptoms associated with, COVID and the COVID-19 coronavirus. So yeah, so having a doctor that's, up to date and using the latest treatments and protocol available is very important. I'm going to give out Dr. Gupta's info again. It's Dr. Hina Gupta, entbroward.com, 954-943-1418, located in Coconut Creek. You can get all the info on the website or by calling, and we'll give that number out again as well. I talked a little bit before about different hospitals you're on staff at. Are you still doing rounds, or do you see your patients if they're in the hospital? How does that work? Where are you on staff at, and what's your, the work you do there?
Absolutely. So I go to two hospitals now. I go and do surgery and see my patients at Broward Health North, and I take children who need, like, say, tonsillectomies or ear tube procedures. And I usually take kids to Coral Springs Medical Center. I also go to some surgery centers in Boca, Coral Springs, and Coconut Creek.
Wow, that is a lot of locations. Very busy, young doctor, but very busy and very passionate about her care, and that's really important. Dr. Gupta, why did you decide to become an ENT, or am I saying this right? Otolaryngologist? I always butcher that word.
You're doing fine. Otolaryngologist. I like the
Thank
fact
you.
that I can see a 5-year-old in one room and go to the next room and see a 100-year-old patient. There's a lot of variety that I can see both with the types of patients and the types of diseases that I treat.
That's great as well. And, the other side of it is you can provide, care in the office, and then you can also do different kinds of treatments and procedures as well. Dr. Gupta, it's hard to believe we already ripped through 30 minutes, but I'd love to have you on again. And thank you for bearing with some of the technical issues of connecting, but we'd love to have you on again. It was fantastic.
Thank you, David. I really appreciate it.
And again, that's Dr. Hina Gupta, ENT, ear, nose, and throat, entbroward.com, 954-943-1418. We'll definitely get her on again soon, and we'll see you next time on the You and Your Doctor Show.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.